So you'll get a copy of the recording probably tomorrow morning, along with links to any resources and a link to the careers page for Cleveland Clinic as well. So Zach, I'll go ahead and toss it on over to you and you can get things kicked off.
All righty, sounds good. Thank you, Kristen, for giving us the opportunity to speak with you guys here today. My name is Zach Nichols. I'm our University Relationship Manager here at Cleveland Clinic, and I am joined by my colleague and rock star nurse manager, Bree Fedor. Bree, I'll let you go ahead and introduce yourself as well.
Everybody, my name is Bree Fedor. I am a nurse manager on a general surgery, gynecological oncology surgery unit here at our Hillcrest location with the Cleveland Clinic. I've been with the Cleveland Clinic now for 8.5 years. I have worked at the main campus to start my career, was an assistant nurse manager in thoracic surgery, cardiac surgery. Prior to this was a manager over a medical oncology unit at Hillcrest, where we received the PRISM Award, and now have in the last month transitioned to this larger unit. So been a little all over the clinic and their different sites that they have throughout my years with them.
Awesome. Thank you for the introduction. And so I think Kristen kind of touched upon it to get us started, but we want to do a couple of things here today, do a little overview of Cleveland Clinic, some of our RN options that we have for you, and some of the incentives that we offer as well. And then we wanted to go into kind of a deep dive on the interview process at Cleveland Clinic, what questions on my side in HR or recruitment that you may get, some questions that a nurse manager like Bree would ask you, and overall, and again, I'm seeing some great questions popping in here already. Overall, just answer any questions, provide some advice, and any networking opportunities that we have as well. All right, so I'm going to go ahead and share my screen here. Just give me 1 second. Okay. And I am, right, 1 second. There we go. Perfect. Sorry, had a couple of PowerPoint presentations up there. Are you all able to see my screen?
Yes.
Okay, perfect. We're me and Bree are Microsoft Teams, so when we're on WebEx, we always have to kind of like double check, you know what I mean? Kind of did some introductions already, but I'm our University Relationship Manager here at Cleveland Clinic, Zach Nichols. It's my job to inform you of opportunities for nursing students at Cleveland Clinic, make any connections that you're interested in, and help you find, what matters most in that rewarding nursing career. Wanted to start off just doing a little overview of the RN options that we have here at Cleveland Clinic. And I believe from our past webinars that a majority of you guys have worked as an RN or have some previous RN experience. So I won't touch a ton on our RN residency, but just in case we do have a few of you that are joining us that may be new grads, I do want to do a quick residency overview. And then we'll dive into our locations, our incentives, to make sure that we're providing you with as much information as possible. But to get us just kicked off here, I think Cleveland Clinic, the bedside support that we offer you as a nurse is something that we're well regarded for and known for. But I will say that I think during the pandemic, we did look at ourselves in the mirror and say, how else can we support you guys, not only at the bedside, but also at home in the form of financial security, and then also throughout your career with a couple different career tracks that we have as well. So again, I'm going to do a quick residency overview, and then we'll dive into a little bit more about Cleveland Clinic and then get those interview tips answered as well. So with Cleveland Clinic, the first year working with us, if you're a new graduate, would be in our RN residency. The RN residency is specifically designed to set you up for success and to support you in that first year as an RN. So how do we support you? First things first, we create a customized orientation specifically for you. And then we do about a 10 to 12 week orientation, 1 to 2 weeks of central general orientation, and another 8 to 10 weeks of unit-specific orientation. So in other words, we kind of get you together with all the new incoming RNs, but then you go to your unit for 8 to 10 weeks of unit-specific orientation. We do rolling start dates for our RNs. So usually there's 2 to 3 starts every month, and we can be pretty flexible on those start dates. Bree, anything that you would add also on the RN experience side of things, like when they're starting, that I didn't go through?
I think the biggest things are it's just very tailored to each individual person. We really work to tailor what we're doing with the person, make sure that we set you up for that success. Having that open communication with your manager or your management team is very key to helping be successful. So if you're not meshing with a preceptor, things like that, there are things to be done. So really keeping that open line of communication to ensure that you're going to be successful as possible, and really focusing in on what it is that you want and need is important.
Absolutely. And speaking of what you want, it kind of depends on what you want to get out of your career. We do have some career tracks to get you going in the direction that you're most interested in. If your goal is to be an assistant nurse manager in a few years, if you want to be a nurse manager like Bree, a CNO of a hospital one day, we do have a leadership track for you. And also, if more specialties are your thing, ED, med-surg, critical care, whatever it may be, we do have a specialty career track for you as well. And you can do both of those at the same time. You do have regular check-ins with your nurse manager, your assistant nurse manager, just to, kind of temperature checks, make sure you're where you need to be. And if you need any additional support or to celebrate any wins, the nurse managers are going to be right there for you. There we go. In terms of Cleveland Clinic locations, I know a lot of you guys could be from anywhere in the U.S. So Cleveland Clinic has over 20 locations worldwide. Our two biggest pockets of hospitals, we have 15 here in Northeast Ohio, so in the Cleveland area, but also the Akron-Canton area as well. And then we do have 5 hospital locations in Florida. So either of those, if you'd be interested in, we do start both new graduate RNs and experienced RNs. And then after you work 1 year with us, if you are interested in internally transferring, whether that's Cleveland Clinic location or unit to unit, going from Ohio to Florida, that's absolutely possible after that first year of working with us. Additionally, if you're interested, I know there's a lot of interest in traveling. Cleveland Clinic can potentially do that too for you. If you work 2 years domestically with us, you can potentially transfer to London or Abu Dhabi. So we do have those options as well. We've been a top 5 hospital since 1999. We have 10 specialties that are all ranked in the top 10. Bree, anything else that you would add onto that I didn't cover?
I think the biggest thing is just really figuring out what it is that you want with your nursing career. And if you don't know what that is, working with someone to try different things. There's so many options and even certifications that you can get for free through the Cleveland Clinic. They'll pay for a different certification every year to really specialize in what it is that matters to you most.
Absolutely. I won't cover too much of this. This is more for PCNA nursing, nurse associate externship. We do offer patient care nursing assistant roles if you are a new graduate and you do want to, get into one of those units and work as a nursing assistant before you pass the NCLEX. That is something that would be available to you. In terms of our options that we're offering for you with incentives, so Cleveland Clinic has added a few new ones that we're very proud of to help support you, not only at the bedside, but again, also at home. We are doing a loan repayment program where we are paying back up to $15,000 in student loans. And the way that works is after you complete your first 90 days with us, we make payments of $437.50 a month directly to your loan provider. All right. Additionally, simultaneously, if you wanted to enroll in our tuition reimbursement, go for your MSN at WGU. We do also offer $5,000 in undergraduate tuition, and then there's $7,500 in graduate tuition reimbursement. So if you ultimately want to go for MSN, DNP, PhD, something like that, $7,500 a year, and there is no cap on that. So if you're in a MSN to DNP that takes 5 years, 7 years, you want to add a PhD after that, we're just going to continue to help you pay for that so you can add those letters to your name. And then last but not least, we do offer relocation assistance as well for new graduate RNs. And yeah, Kristen put in the chat, there are also scholarship options as well with WGU. In terms of at this point, I kind of want to switch gears and switch over to our interview format. Did just want to take a pause for a minute to see if there were any questions just regarding some of the RN options or incentives that I just went through. All righty. So I think at this point, I want to kind of dive into Cleveland Clinic's interview process, and then also, ask Bree some questions about what she asks RNs when they're going through the interview process here with Cleveland Clinic. Bottom line is Cleveland Clinic is essentially a 3-step interview process. The first step, you can apply online. I know Kristen said she was going to put the link to our job applications board in the chat before we wrap up. But first step is a HireVue video interview. So after you apply, there is a virtual interview that you record called a HireVue as your first step. And this is really going to ask you some basic questions just to get you started with us. More so on the HR side of things, some areas that you're interested in. But that HireVue is a recorded virtual interview that you start with. And I think one thing I would just suggest as far as a tip goes with that, sometimes it can be tough when you're doing the virtual interview. The lighting in a room can be a little off. Try to find a well-lit room where you can record yourself, and also just make sure it's an appropriate background, right? So, if you need to blur out your screen, totally fine like I'm doing now, but just make sure it's well lit so that while you're recording, you can be seen by the recruiter. After you do your video interview, there is a one-on-one recruiter phone screen. And I kind of like to say that this is more of a matchmaking process, all right? So before you talk with a Cleveland Clinic recruiter, I'd highly recommend coming up with a list of units, specialties, locations that you're interested in. That's what they're going to be discussing with you on the recruiter side of things. What area you're interested in? Is there a location, shift preference, day-night rotating, night shift? What are you looking for? So I think coming up with those lists of specialties and locations that you're interested in is going to be very key when you're speaking to our recruiters. After that, step 3 is an in-person nurse manager interview with somebody like Bree, and we do a shadow as well, all right? So that's part of our interview process. We do want you to shadow, want you to get a bird's eye view of the unit, kind of see if this unit's going to be a good fit for you. Is it the culture that you're looking for? But would highly recommend taking advantage of that shadow as well to make sure that that you're getting all your questions answered and that this is a good fit for you as well. All right. And at that point, we should be able to give you a decision in about 24 to 48 hours. So we're usually pretty quick with our turnaround in terms of our decisions. And once you accept with us, again, we typically do about 2 to 3 start dates every month where we can shift that start date around based on, the time and date that is going to work best for you. All right. Wanted to kind of talk through a little bit about some of the tips and tricks that we would suggest. First things first, it is okay if you want to interview in scrubs, if you want to interview business professional. But I think, again, just keep in mind, if it is that virtual interview versus in person, making sure it's in a well-lit room and making sure that you're dressed for success. You do need to wear scrubs, I believe, if you're going to be shadowing. Is that correct, Bree?
Yes, that's correct.
So if you do want to shadow that day, you can dress for the interview business professional, but make sure you bring those scrubs along so that you can shadow. And then I think just an important thing to note is nonverbal communication when you're going through any interview process. So make sure that you're making eye contact, that you're standing up straight. Those are some very key pointers, I think, that really go a long way. The shadow experience, Bree, do you want to talk a little bit about some tips that you would give for taking advantage of your shadow when you're coming in as an RN candidate at Cleveland Clinic?
Yeah, so what I really like to tell people coming in, not only is the shadow an opportunity for you to get a feel for the unit, it is part of our interview process. So making sure that you're remaining professional during the interview process, coming prepared with the questions that you want to ask that person you're shadowing with, asking them the things that you want to know about the culture, about the teamwork, about what the unit's like. That way, it shows how prepared you are and how interested you are in that area. And then also, that's your time to observe what's going on around you. Biggest thing, please put your cell phone away. I cannot tell you how many people bring their cell phones to interviews, and it should stay in your purse, in your bag, whatever that is, but not having it out during your shadow, because that is something that we do see a lot more often, and it isn't considered professional. Making sure that, if you need more time to shadow and someone's pulling you to interview you or asking if you're good, say yes. I would really like that time to shadow, and you can shadow for as long as you want to. They will give you that opportunity to really see what the workflow's like. Some people like to come in the mornings because that's during the normal med pass time, starting to discharge people. So that is a great time if you really are interested in seeing kind of the workflow of a unit. Coming in during that morning hours when the things are starting to happen is a great time to see how that workflow works.
Great point. So maybe picking the ideal shadow time based on the unit or the shift that you're interested in can be a good tip. I think another tip that I would add on the HR recruiter side of things, and I would just preface by saying if you don't have a LinkedIn account, would highly recommend getting a LinkedIn. That's number one, an area you can really expound and elaborate on your experience as an RN while you were in nursing school. That helps recruiters reach out to you. But I think a big tip that I would provide is before you go in for your interview with a nurse manager, look them up on LinkedIn. All right. Write down maybe 2 or 3 things that you find interesting about that nurse manager or questions that you want to answer or have answered by them. Maybe they went to the same undergraduate institution as you. Maybe they got their MSN in psychiatric mental health, and that's what you're interested in. Or they have their DNP. So writing down, I think, 2 or 3 questions based on that nurse manager's candidate profile on LinkedIn, I think can be very helpful.
And I have to say, I say too with the LinkedIn, I know for me, from a manager standpoint, I do look if people I'm interviewing do have that LinkedIn profile, because if I'm between 2 candidates, it might be that profile and what I see in that profile that might set that candidate out from the other candidate. So it's something we do look like as managers to see what this person's done. Do they have that professional profile to really give us that insight into our candidates as well?
Yeah, great point. So if there's competitive applicants, Bree could use LinkedIn as kind of that deciding factor. And I think too, Indeed is another one that you can use. I think of more experienced RNs tend to use Indeed as well. It doesn't necessarily provide, from what I've used, necessarily the profile style that LinkedIn does. So either way, highly recommend getting a profile on either of those. After you interview, number one, always email the recruiter and the manager, thanking them for their time, especially the nurse manager. I think this is something, Bree, what percentage of candidates do you think actually send you a thank you email?
So it's gotten less and less. I'm probably maybe down to about 10% at this point. Part of it, I think, too, is we're trying to be a little quicker on that turnaround. So there is that quicker turnaround with our decision-making process, which I think has maybe contributed to that, but it's definitely gone down a lot less. And again, when I'm in between people, seeing that extra step and what those people do have made those people stand out.
Perfect. Yeah. So maybe after you interview later on that night when you get home, quick email. Thanks for your time. Interested in the position. That's all you need, but it makes you stand out. And then post interview. So again, Bree just said we're trying to make decisions hopefully in 24 to 48 hours. Every now and then, if it is a competitive unit, it can take a little bit longer. But the appropriate time, if you still have not heard back from a recruiter, about 5 to 7 business days is typically the appropriate time for that follow-up on your decision. Wanted to go through some common interview questions here. And I think that I also just wanted to state with the Cleveland Clinic interview process, it's about what you know, not what you don't know. All right. So myself in recruitment, Bree, especially as a nurse manager, nobody's trying to ask you questions that are going to stump you, that are going to trip you up. These are very much questions that showcase what you know, not what you don't know. All right. So I know we all get, before you go in for an interview, like a little bit of that interview anxiety that happens with everybody. But I think just kind of keeping in mind, especially with Cleveland Clinic, that we're trying to see what you know, not what you don't know. All right. I think one of the most common questions, and I think this is something that I'll have Bree elaborate on in a minute, are the behavioral-based questions, otherwise known as BBIs. So these are the questions where Bree's going to ask you, tell me about a time when blank happened. All right. And I think a way you can answer these are through the STAR method, which is situation, task, action, result. All right. I think if you use that STAR method, it's a good way to, sort of state the situation. What task did you execute, or what action did you go through? And then ultimately, what was the result? Where did it get resolved at? So Bree, I'll kind of toss it over to you if you want to give a couple examples of some of the questions you ask RNs when they're going through the interview process, kind of those behavioral-based ones.
So some of the different questions I really like to ask people are to tell me about a time where you had conflict with either a coworker or patient and what you did to resolve that. Another great question I like to ask is, can you tell me about a time you went above and beyond and what that looked like? Another common question I like to ask is, tell me about a time you worked in a team. What was your role and what did you accomplish? And some other things I like to dive into is having people tell me a little bit about themselves professionally and kind of what brought them to apply for the position. And then I like to have them tell me a little bit about their experience in the healthcare field and if there's anything they did that was kind of outstanding and what that outstanding project looked like. And then another thing I like to talk about is going into, if it's depending on what the specialty is. So when I was in my oncology area, there was different processes, or in our med surg, focusing on what is those common things and talking about situations of the patient population and seeing the knowledge base in that area. So usually when you have those little higher specialty areas, there might be questions. For example, when I used to do cardiac surgery, can you tell me a little bit about how the heart functions and how you would manage a patient with atrial fibrillation? So when you're in those little higher acuity, more competitive fields, you might field some more of those type of questionings.
Yeah. I think a real, just, basic one, like Bree talked about, is, why are you interested in the position? I think that's something that we just want to know, generally speaking, what's got you interested, what attracts you to the job. And then I think, again, kind of those basic, was there a situation where you responded to some adversity? The difficult patient one that Bree mentioned, you're going to have difficult patients as a nurse, right? So those are some pretty common ones that I think, you'll be often asked through the interview process. Clinical experience. Bree, do you want to talk a little bit about any questions that you asked pertaining to the clinical experience a student just would have had?
So most of the time, I really, in my type of areas, don't really focus on the clinical experience. My thing is, I just ask them whether or not they had in-person clinicals versus virtual, because sometimes due to COVID, we're still seeing some of that. I talked to them if they had any projects, capstone projects, practicums, anything that they kind of did. I asked them if they've had one-on-one, and then just kind of the basic areas of where they've been to. And a lot that I tell people, some people don't have a ton of experience in this medical world. So it is okay, say you're a second degree student or something like that, to give an example from one of your previous positions that demonstrates leadership or going above and beyond. So pulling from those experiences, clinical experiences are great and focusing on nursing, but if you have a better example from one of those areas to best answer in that STAR model, go ahead and use that, because we're seeing that more and more, that people are taking this second career in nursing or have these other backgrounds prior to becoming a nurse that have made them show their excellence, leadership, teamwork, and that is okay. But highlighting those things too in the clinical experience, say you did something, you want to go to pediatrics and you had your practicum in pediatrics and did a project on babies in relation to something. Highlight that during your interview, because that's what the nurse manager is going to want to see, that you had this interest, this is what you did, here's your experience in that specialty area.
Yeah, I think really, really good point on the non-healthcare experience, especially if you're more of a new graduate and have not worked as an RN in the past. One of the examples I always give is Starbucks, barista at Starbucks. You can tell it's been a long day for me. A barista at Starbucks, you had customer service skills. You probably had some situations where a customer was upset with you. You're good under pressure because people want their coffee fast. So I think kind of just relating non-healthcare experience, and even if it's from a while ago. I had a student tell me the other day that his resume only went back, I think it was like 10 to 15 years, which is usually pretty appropriate. But he said he was a firefighter in the 90s. Well, that's huge experience. Like that would look really, really good in the eyes of a nurse manager or a recruiter. So definitely relating those non-healthcare or non-nursing experiences. And I touched on it a little bit already, but just kind of reiterate with when you're speaking with a recruiter, this is mainly those matchmaking questions, locations you're interested in, specialties. Tell me about your incentives. That type of more HR related question is what you're going to be asked by the recruiter. And then just real quick, wanted to go through our application requirements, and then we're going to get to your guys' questions. Again, I know Kristen's going to be sharing our online application. You can go in there. You can search for jobs, specialties, locations that you're interested in. Cleveland Clinic does not require references, so that's something you don't need, at least on a resume with us. We do not require letters of recommendation. When you go through a lot of hospital application process, it kind of gives it like an option for you to attach your resume. I always say please attach it. That's something that the nurse manager usually wants to reference. When they're interviewing you, sometimes print it out to have. And then lastly, if you do already work with us at Cleveland Clinic, you're going to be applying internally through Workday. That's sort of our internal applicant tracking system. So having said that, we're going to transition and see what questions that you guys had. So I wasn't able to see the chat, but would love to kind of reference that to see if we had any questions that had popped up. Oops. Am I still sharing my screen here? Sorry. Yep, not a WebEx guy. Here somewhere. There we go. Okay. Okay, so let's go back through here. And again, if you have questions, please feel free to type them into the chat. So from Shay, how to address pay with a potential employer, especially those that post large salary ranges. All right. So at the Cleveland Clinic, we pride ourselves on being transparent with pay. That's a question you can ask a recruiter. I had this question earlier today from an event I was at. If that's your first question you want to ask a recruiter, totally fine by us. All right. Keep in mind that we do have sort of it's a step structure if you're an experienced RN based on the years of experience that you work. So sometimes there can be like a review process with your resume, but just know at Cleveland Clinic, we're very transparent about pay, and we are happy to discuss that up front as soon as you're ready. Nicole, wondering about tips to always keep things positive, even when talking about weaknesses. So I'll start with this one. Also want to hear Bree's thoughts. But I think number one, admitting that you have a weakness or an area that you're maybe not so comfortable in would be the way that I would word that. Understand that Cleveland Clinic's all about support. All right. So if you have an area that you do need additional support on, or want to ask how we can support you, I think expressing if there's an area you're not so comfortable in, that's completely okay. All right. So I think being transparent about that is certainly something that probably would not be viewed as a negative. I would not say, as an example, that my weakness is I haven't been showing up on time. All right, that's not a good example. All right, or something like I have problems with time management. All right, those are things that are very crucial to the nursing profession. So again, I think I would approach it more maybe from an area of I am not so comfortable with Epic or something. What are your thoughts on that, Bree?
I would agree. I think if you say you do not have any weaknesses, that's a huge red flag for any manager that's interviewing. Being very just careful in the way you word it. So saying you're very highlighting your strengths and then maybe saying you have an opportunity to grow in your knowledge base for that population. So that's a great one to talk about because if you've never worked the population, that's an area. Or saying that, you have an opportunity to further learn about the ethics system and how that functions and just that wording, but talking about like key characteristics like Zach was saying, as such as, being timely, having time management skills. Those are things that can be harder to teach. So it's just the wording and the way that you say your weakness.
Yeah, and there is a question on here on contracts. So I think that is something I'm not sure that I would be able to answer. I think more on the HR side of things with us. I know Cleveland Clinic, correct me if I'm wrong here, Bree, does do some RN contracts, but I think it's kind of a separate process from us, correct?
Correct. Yeah. So their process would be going through the HR department, and they would walk through what that looks like. Especially, I see the one about the APNs. That's done through like the HR team versus this.
Okay, here's one from Chevy, which is how do you prep for questions involving nursing quality processes? Do you have anything for that, Bree, that you would recommend?
I think the biggest thing with the nursing quality processes is kind of looking at the area you're interviewing for, what are common practices in that area, and looking, for example, if you're applying to the Cleveland Clinic, what is our practice model? What are our values? And seeing how those align and having things. And again, it's okay to say, that you're unfamiliar with this process, and that would be an opportunity for you to learn more about it. But you saw that the Cleveland Clinic's very quality and safety driven, so this would be great, and that's what you're looking for. So it's kind of spinning it around if you don't know that topic, because there is things that people won't have that awareness to. But as much research as you can do into the company, the organization that you're applying for, and then with that nursing and quality practice, usually everything's centered around safety. So focusing back to that.
Yep. I think always, do a simple Google search of Cleveland Clinic. Did we win some new award or magnet certification? Is there a new, location going up? I think a quick Google search about where you're interviewing or who you're interviewing with, kind of what we talked about with LinkedIn before, really, really helps. Nicole has a question on questions about recalling conflict. I just know I'll ask Bree here about if there's any questions that she has, but I will say, I think with just conflict, a lot of times the answer that you can go with is make sure you're discussing how you resolve that conflict, right? How did you de-escalate? I think is great for the answers. Do you have any questions you use for conflict situations, Bree?
The main one I ask is, can you tell me about a time where you had conflict with either the coworker or patient, what you did to resolve that? Is the best one I usually like to ask. Or I'll specifically ask, how did you deal with a conflict with a coworker and how you did to resolve it? Kind of what I'm more looking for is going through the process of one, acknowledging that you have had some sort of conflict, not saying you've never had conflict. Two, with the conflict going into you know, how you had open communication, having that direct one-on-one conversation. It's fine to say if you had to escalate because it was unresolved to a manager, but what that process was, and then the end result after we did these interventions, here's how me and this person have learned to work together. So what is that resolution process, and were you able to successfully do that?
There's a question, I believe, about advanced practice nurses. So in talent acquisition, the department I work in, I specifically work with RN new grads and experienced RNs. But I can put my email in the chat, and if you have questions about APRN, I can connect you with my colleagues in that department. It's just a little separate from talent acquisition. And then Nicole states, Bree, this might be something that would be great for you as a, you're somebody who had transitioned to assistant nurse manager and nurse manager a couple years ago. Nicole says, I'm interviewing for my first management position next week. Good luck, Nicole. Any tips on talking about transitioning from staff nurse to manager?
So I think when you're transitioning from a staff nurse to manager, it's really showing what it is, that passion that's driving you there. Being prepared with examples of different things you're involved in. So really being involved on the unit, whether that's through shared governance, working on a project for improvement, really what quality initiatives you've been working on, being able to talk to things that you've done to help lead change, being open to innovations, um, all those different things. If you can show examples of maybe you got recognized for something or won an award, pointing those types of things out. Um, and then really, if you're in the organization, if there's a different area that you can talk to another A&M that works there and say, I spoke with so and so, shows that initiative you took to learn more about the position and what it's about, making sure you come prepared with questions about the unit. And I think going into management today, understanding, especially in the A&M role, what's that expectation of in staff, out of staff, what managerial duties that you will be taking on, and kind of what is that support system and process for orientation. Just because with the way nursing's changing and stepping into that management role can be a little harder, but it's so rewarding with what you can do. So it's really just coming very prepared with a lot of those different examples of things that you've done, and really showcasing all the things that you've been able to do in your role as a staff nurse. If you're a charge nurse, frequently letting them know that you do that. So different things like that, and then really just being clear on what's propelling you to want to take this management role and take that next step.
There's a question on, does nursing experience affect pay, or does it like other outside healthcare experience? If you're interviewing for an RN experience position at Cleveland Clinic, it is going to be that registered nursing experience that does affect pay. And then Courtney has a question for standing out on your resume, and if your tips for standing out on your resume, and or it sounds like if you're a little quiet or nervous for your interview. So I think on the quiet or nervous side of things, I think understand again that these questions that we're going to be asking, it's about what you know, not what you don't know. So we are not trying to trip you up. We know that, the interview process, sometimes it can be, it can get you a little nervous. But again, just understand it's all about support even through the interview process. So as much as we can, we want to calm those nerves, kind of, ease the pain of the interview process. And I think one thing I would say too is, we kind of gave you some tips about recalling some of your previous experiences, whether it's healthcare or not healthcare related. Um, but I think another one that I always do before I interview is you can just Google like top 10 interview questions and just kind of play a game where you kind of walk through and pretend like they're asking you that question to see what your response would be. That's something I think that it sounds kind of simple, but kind of play, a little mock resume or mock interview with yourself is something that can go a long way.
And another thing, if you're already a nurse, having different people ask you some practice questions, or asking someone that's been through the interview process what they've done on a resume, just having those highlights of not going too in depth into what your clinicals were, but giving those things that you did with your clinicals that make you stand out, like those projects, or if you volunteer or things like that. And then, like we said before, doing your research ahead of time, going on that LinkedIn to prepare those questions. When I have someone that comes in saying, "Oh, I saw your LinkedIn and you won the Prism Award," I'm like, "Oh, this person's really interested in my unit and took that initiative."
Yeah, great points. Yep, and as Kristen says, the WGU Career and Professional Development team also does mock interviews. It's a great thing to do. Would highly recommend doing a mock interview with your career services department. That's something I think would be great to get that more of that interview experience. I wanted to give it another minute or two to see if we had any last questions that pop in here. I think we got some great ones here today, guys. A lot of different questions from different angles. So Bree and I will give you guys another minute or two if you have anything else that you want to pop in there for a question.
And if you do want to come off mute, just raise your hand. I'm happy to take you off mute if you would like to do that. But I will go ahead and stop the recording. I know sometimes people don't want to ask their questions on the